Afternoon, everyone. And my name is Chris Hurley. I'm on the programming committee for the Penn State Retirees Association. And I'd like to welcome you to the 441st meeting of our association. This is our annual benefits meeting, which is always well attended and well received. Before introducing today's presenters, I would first like to introduce our association president, Glenn Carter, for some comments and updates. Glenn?
Okay, welcome aboard, everybody. Looking forward to a good session here. My job is primarily bringing you up to date on what the association is up to, and I'll keep it very brief. We did have a board meeting yesterday, and I'm pleased to announce that I think we have a record number of enrollees in our association now, 1,413. I think that's a record over the last 70-some years. Your board is found a group of diverse people doing a lot of different jobs. It's an honor to be part of them. They're a fantastic bunch of people, and they work hard for you. One piece of information that happened not like yesterday, but earlier, was a decision to make it firm that we're going to have our bi-monthly meetings on the third Thursday of each month. That may not happen every time because of circumstances, but that's our goal, to be consistent so that everybody knows what's going on. We have been working on a number of goals. My personal one is to try to build a stronger relationship with the university. And we're making some progress there. We've had a good relationship with them, but I think there's a lot more. There's 1,400 people out here who I think can contribute better, more so than to the university than they are. And the reverse of that is the university can be supporting us as well. We've had about a year and a half now in which we mostly virtual viewing like today, and it's been satisfactory, had good success, but we love to see some people face to face. We did have a good meeting at the Ag Progress site last month in September, and had a great meal and a good program. And I hope we can get back to that as soon as we can, but no promises until we find out how those things are going down the road. One last thing I want to ask is for anybody who might have an interest in serving on any one of our committees. Our program committee particularly needs help, and the membership committee and the publicity and the communications committee all can use some help. If you or you know someone who would be able to serve on one of those roles, we sure hear from you so that we can take advantage and do a better job of serving you as members. And with that, I'll turn it back to Chris. And on with the show.
Thank you, Glenn. First, some housekeeping. During the presentations, you will be able to submit questions. The questions will go into a queue, and after each presentation, the presenter will review the submitted questions and provide answers as appropriate. Depending upon your advice, you want to look and find the Q&A button. All you need to do is click or toggle that Q&A button, and then you can submit a question. Today, we are pleased to have Kelly Bartley-Weber, who is a Penn State Retiree Benefits Specialist in the Office of Human Resources. Kelly's presentation will focus on retiree benefits for non-Medicare eligible retirees. After Kelly's presentation and Q&A period, we will be joined by Tyler Quinn, who is our client manager representative of Highmark Freedom Blue PPO. Tyler's presentation will focus on the 2022 Penn State retiree benefits. Tyler will also respond to questions submitted after his presentation. And now it is my pleasure to welcome Kelly Bartley-Weber. Kelly?
Thank you so much. I appreciate the time here today. I am going to work on sharing my screen and getting the presentation ready to go. There we go. Okay, so as Chris mentioned, I'm going to join you today, and I'm going to review the Penn State retiree non-Medicare health plans. So without further ado, let's go ahead and get started. I do want to share with you that our medical and prescription coverage for the non-65 population, the plans nor the rates are going to be changing. So we are going to stay with Aetna and CVS for the calendar year of 2022. We do have two different plan options. We have the retiree PPO plan. This has that $375 individual deductible, $750 family deductible. This is the plan where you have a $20 or $30 office visit copay or specialist visit copay. And then you have a $2,000 per person maximum on your prescriptions. So you're typically paying a co-insurance of about 50% for generics and preferred, and 70% for non-preferred, up to that $2,000 maximum. Now, I do want to let you know we have full benefit summaries listed on our guide to retire, or not our guide to retirement. You guys are our retirees, on our retiree website. But a quick overview of our PPO savings plan. It's going to remain with the same deductible. So it's a $1,600 individual deductible, $3,200 family deductible. And as a PPO savings member, you do have the ability to continue to make contributions to your health savings account. What you would do is you would work directly with Health Equity, and then you would work with your tax advisor at the end of the year to take an above the line tax deduction. And just a reminder that there is no longer annual seed funding from the employer if you stay in the PPO savings plan. Now, we did mail out our letters about the week of October 25th. And there is a plan change option for the non-65 population. So if you're in the PPO plan and you want to go to the PPO savings plan, you would complete that form and send it back to the employee benefits team by November 22nd. Also, a quick reminder that you are not mandated to use a CVS pharmacy. Many times people will ask, do I need to use a CVS pharmacy because I have CVS Caremark? And, you know, CVS Caremark has a plethora of participating pharmacies. They include our chains, the Rite Aid, Walmart, Target. In the Center County area, our local grocery stores, Giant, Wegmans. If you're a little bit further south, I think it's Food Lion. If you're a little bit further north, it might be Stop and Shop. But just a reminder that Walgreens is not an in-network pharmacy within the CVS Caremark umbrella. And you do have the ability to use our University Health Services pharmacy with University Park campus. Another reminder that for the non-65 population, that you get a cost savings when you are using Quest Diagnostics or LabCorp for your test and lab work. So, you know, typically if you go to a hospital or a facility of that nature, you are going to have a facility that's supporting, you know, a 24-hour emergency room facility and the hospital and the staff and the equipment. So facilities such as Quest Diagnostics and LabCorp, they're standalone facilities. They're open 8 to 5. They don't have that 24-hour staffing. And so a lot of times you're going to see a reduced cost if you use a standalone facility such as Quest and LabCorp. If your doctor is not participating with that, you can ask them for a printed lab order. And remember, if you're, you know, both plans have labs that apply to the deductible being the amount of money you, the member, are responsible for. So you're going to see a lower cost if you're in the deductible part of your plan. If you've satisfied your deductible, you're going to see a 10% cost share when you use Quest or LabCorp. You'll see a 30% cost share with other in-network or hospital-based labs, and a 50-50 cost share with an out-of-network lab. Want to let you know about the retiree billing. We're going to continue on with Lifetime Benefit Solutions. Just a reminder that they send you bills on a quarterly basis. So January 1st, April 1st, July 1st, and October 1st. Bills are due within a 60-day grace period. And you do have several different payment options. You can pay each quarter by a check, or you can prepay, typo on the slide, I just see that, but you can prepay by check for a designated length of time. So you can send in a check for 6 months, you could send it in for the full year. You can establish an automatic withdrawal. That automatic withdrawal occurs monthly. And when you do that, there are no quarterly invoices sent. So you're just going to see that automatic withdrawal happen from Lifetime Benefit Solutions from your designated bank on the 5th of every month. And there is the ability to do a credit card payment. However, those are going to probably be times when you might be in a pinch and you need to get something paid right away, because Lifetime Benefit Solutions does have a fee that their vendor charges them for that service, and it's a pass-through fee of $20. Also want to remind you with Lifetime Benefit Solutions, you might want to check out your member portal. Great way to kind of access some information there as well. And I did see a question come in a little bit earlier on the Q&A. I'm going to go ahead and address it now because it says, if I have the automatic payment set up, will it continue in January or do I need to redo that? And I just want to let you guys know that that should happen automatically. It will continue. There's no need to re-up that. Speaking of our rates, I do want to go ahead and share this. This should have been included in the letter that you all received. We are not changing our rates, so we're not changing our plans or our rates. So it's going to remain at $80 per person in the Freedom Blue plan. And then our PPO plan and our PPO savings plan are done on a 4-tiered basis. So you've got an individual rate, which is just you, the retiree, 2-person being you and a spouse. There's a parent and child and or children rate. And then there's also that family rate. So that is done on a 4-tiered basis. Again, you'll see what those rates are for either the PPO plan or the PPO savings plan. We have, again, I'm addressing the non-65 population, and each year we tend to get the question, well, what happens when I turn 65? I'm going to be turning 65 this year. So I do want to just kind of do a quick brief overview. I want to let you know that approximately 2 to 3 months before you turn 65, we run reports here in the office, and we see that, John Smith is getting ready to turn 65 and Rita Jones is getting ready to turn 65. And we mail out a letter that says, hey, we see you're getting ready to turn 65. You're going to want to take the appropriate steps. You're going to want to enroll in Medicare Parts A and B by visiting your local Social Security office. If it's your intention to stay with the Penn State Freedom Blue plan, you don't want to enroll in a separate Part D drug program. Tyler's going to kind of get into some more basics on this. I just wanted to give you guys a little brief overview. Again, if you're getting ready to turn 65, don't worry about it. We're going to make sure we're in touch with you every step of the way. After you apply for Medicare, you get your Medicare ID number. You want to go ahead and fill out a Freedom Blue application and send that a copy of that into employee benefits prior to your 65th birthday. One other thing I wanted to address, I haven't addressed this in years past, but it is called split plans. And so this is really when we have one that is over the age of 65 and someone that's under the age of 65. And so a lot of times people get a little confused. So I wanted to just share this information, especially if you have someone that's going to be aging into that Medicare plan this year. If you are 65, so you the retiree, you're the older one, your spouse is under 65, and maybe you still have children under the age of 26 that are enrolled in your medical plan. What happens in this scenario is you move over to the Freedom Blue plan, and with Aetna, your spouse is going to become the primary subscriber. So right now, the non-65 retirees, you are the primary subscriber with Aetna, but once you move off, your spouse kind of gets a promotion. They become that primary subscriber, and any children are going to be listed under that spouse. And so when you call into Aetna, instead of giving them your name, the retiree's name, you want to give them your spouse's name, your spouse's date of birth, and then that's how they're going to be found in the Aetna system. So in another example, if you're over the age of 65 and you don't have a spouse on the plan with you, but you still have children on the plan, in this scenario, your oldest child gets that promotion. They become that primary subscriber, and any younger children would be listed as dependents under them. And in each of those cases, your spouse and that oldest child, they are going to get a new ID card with a new member ID number on it. So I'm sharing that to just give you guys a little bit of information about how that works as you make changes through the course of the year, and one of you may age into our Medicare product. And lastly, if you're the youngin, you're the young spouse, you're under 65 and your spouse is older than 65, then your spouse moves over to our Freedom Blue plan, and you, the retiree, remain that primary subscriber with Aetna. So again, I just wanted to review that a little bit. Hopefully that answered any questions for some people who might be aging in this upcoming year. I do want to let you know, it is that time of year where a lot of people get inundated with so much information. And I know that there's information out there about plans that have dental and vision included in it. Our plan does not have that. Tyler's going to go over our benefit design in detail in just a few moments. I do want to share with you that there is the Pennsylvania Association of Retired State Employees. This is for either TIAA or SERS retirees. PARS is an outside organization from Penn State, but I can tell you, I have several family members that are Penn State retirees, and you can bet that anytime they get benefit information in the mail, like I'm their first phone call. So I have seen the PARS information before, and it is an organization where you pay maybe a $20 or $25 annual membership fee. Once you become a member of PARS, they offer you the choice of 2 different dental plans. They offer you the choice of 2 different vision plans. They also have long-term care insurance included in their package of offerings, as well as some hearing plans as well. And so it's kind of a robust program for the elderly population. And if you want to take a look at that, we've put the website there, as well as their contact phone number. And I do want to remind you that being a Penn State retiree, you do also have the IMED discount program. So this is not an insurance plan, but you can take that printout card from the website. You can show it to a participating IMED provider, and you can get discounts on your services or products that you receive from an IMED provider. Now, many times vision places don't do a coordination of benefits. So you can't have a vision plan and your discount plan. I have found whenever I'm going to the doctor's office for my eyes that they will, they'll take the best of the benefits. So whether you're an AAA member or this IMED, member, they kind of take a look at all the things that you have. And a lot of times your vision providers will work with you to get the best benefit. Okay, so as we're wrapping up, I'm going to go ahead and take a few minutes to take some questions. I see some that have come in the question and answer, but I do want to leave this slide up. The next slide is just the question and answer slide, but this is kind of an important slide. Ooh, let me see if I can go back. I want to leave the phone numbers up because if you are a non-65 member, you want to go ahead and reach out to Aetna or CVS for additional questions. If you have your health savings account still with your PPO savings plan, you would reach out to Health Equity. Lifetime Benefit Solutions, they're our retiree billing vendor, so their number is here as well. We also have the Highmark number on this slide, which I'm sure Tyler is going to have that in his presentation as well. But for those of you who may be aging in to Highmark, I do want to share that we have a non-member number as well. And so this non-member, maybe here it is November, December, and you're getting ready to age into Freedom Blue come March, but you need, knee surgery. And you know how it's working under the Aetna plan, but you're not sure how it would work under the Highmark Freedom Blue plan. You can call this non-member number, give them the reference code. And Tyler, I'll ask you to jump in here. Are we starting with the 22 yet, or is it still 21? I believe until December 31st, we use reference code 21.
Yeah, it depends on your age-in date. If you're, going to be aging in the calendar year of 2022, you would want to reference 22, but the number in the front just corresponds to the year that you'd be eligible. Okay, perfect. So that reference code is going to allow those Highmark representatives to answer any questions you may have about how continuous care, your follow-up physical therapy or anything of that nature would need to be handled. So that's a great resource as well. In addition, don't forget about our Penn State retiree website. If you haven't received a copy of your letters, we do have the letters posted on the website. We're getting the new grids for 2022 put on the website. So we have our resource chart there. We have retiree rates, the benefit summaries. That's a great resource. And as always, our HR services team, you can always give them a call. We work closely with them. They answer the majority of the questions that come in. If they're not able to answer those questions, they do bump them over to the benefits team. And so with that, I'm going to go ahead and answer a couple of these questions that have come in. If you could just give me a moment, I'm going to see if I can navigate through this. Says, I'm a widow. When I turn 65, my son will still be on the plan. No other children. What happens? Okay, so if you are under the age of 65 and you're both on those Aetna plans, you will move over to the Highmark Freedom Blue plan, and then your son will become that primary subscriber with the Aetna plan, whether it's that PPO savings plan or the PPO plan, and that child will get a new ID card. Let's see, I turned 65 August 13th, 3 days after the spouse does next year in July. Will they split the plan for that short of a time? Yes, we do, because the rates are done on a monthly rate, monthly billing rate.
And additionally, Medicare only allows us to put people into Freedom Blue the first of every month. So yes, you are going to have a split plan for that short of a period of time. Let's see. How am I doing on time? I still have time to get through some more questions. Did I understand that we can contribute to an HSA? My accountant said I needed earned income. You do have the ability to contribute to the health savings account, but you would do it directly through the vendor. And then you do have to work through your accountant to take an above the line tax deduction for that for that pre-tax benefit. So, you know, that is my understanding of how it works. I do always recommend that people work directly with their licensed tax advisor, as we're not licensed tax advisor here in benefits. And so, you know, if there's something that they're seeing within your own individual circumstance, they would definitely be the best people to offer that advice.
You're okay, Kelly. You can continue with questions if you want to address some others.
Thank you, Chris. I live out of state, so what differences should I note or be aware of? What can I still qualify for? Again, I'm going to assume that this is the under 65 population, because this is, you know, kind of what we've been talking about to start. I'll let Tyler address that question with the Medicare Advantage plan. But for our non-65 plans, they are PPO plans, preferred provider organizations. That means they have a national network of doctors. So, you know, if you, for example, I'll give you a perfect example. My son is 21. He's going to be 21. He's going to be 21 on Christmas. He's going to be 21 and he lives up in Connecticut, but he's still on my medical benefits. And so he has an entire, you know, kind of population of Aetna participating providers up in Connecticut. So all you would need to do is log on to the Aetna.com website, and you would be able to put in your zip code, and it can populate your area of those participating providers you're looking for, whether it's for a primary care physician or a specialist or anything of that nature. Okay, let's see. Someone is asking who is the vendor. I think that we were pretty for our medical plan, on non-65 medical plan, it's Aetna. And for our pharmacy, it's CVS Caremark. Additionally, I do want to mention, someone is asking about telehealth, and I understand that that's for the Freedom Blue plan that they've asked, but I do want to let you know, you know, the Aetna plan does have that built in as well. There is a teledoc service. I myself have used it this past year. I have this lovely cat that I rescued when she was 6 months old. She's a feral kitty, and she gave me a nice little bite. And, you know, I didn't do anything about it. The next day I had a fever. The bite had this big red mark around it. And I didn't want to go to the emergency room. You know, it's COVID, there's germs. And plus it was a cat bite. So I was a little embarrassed just to like actually admit that. But I logged on to the Aetna.com. I signed up for Teledoc. I put in some, you know, health history. I sat in the comfort of my living room, and within 15 minutes, I had, you know, a doctor from that national platform. We did a Skype visit. I showed them my bite on camera, and they sent in a prescription for me. So yes, even the non-65 plans do have that option built in as well. If you age to 65, does that plan change immediately or at the end of the cycle year? That's a great question. Let's say, for example, you're going to turn 65 on March 1st. Medicare says that you are eligible for Medicare the first of the month in which you turn 65. So you're going to want to start that process of visiting Social Security to sign up for Medicare A and B, and they'll make you eligible March 1st. And then with our plan, and again, those Medicare regulations, we need to put you in the first of that month as well. So it's always going to be at the first of the month. So, and it will be dependent upon the timing of how, you know, when you enroll in Medicare, when they make you eligible for Medicare A and B. Again, some of that's going to make a little bit more sense in Section 2. I don't want to steal any of Tyler's thunder, you know. Okay.
You have 5 more minutes if for questions.
Okay, thank you, Chris. I appreciate someone watching my time. If my spouse and I both over 65 move out of Pennsylvania, would we still be covered under the Highmark plan? I think that's a great question, and I'm not going to steal Tyler's thunder on that, so that can be addressed under his part of the presentation. And do you know if PARS covers retirees who live out of state? That would really be a question that you'd want to direct to PARS directly. They go through United Concordia for the dental. I do know that that is a national, one of those larger national dental providers, but I would check in with them directly. Okay, I don't see any other questions coming in. I'm going to see if I can. So that means that without further ado, I'll close this window so I'm not being too distracted. I'm going to go ahead and turn it on over to Tyler for really kind of the exciting part of the meeting. It's going to be the big part. So Tyler.
Thank you. So can I share? I think
I'm
you have
stopping. There you go.
Let's see here. I hope I'm doing this correctly. All right.
Looks good, Tyler.
Thank you. All right, so hello everyone. My name is Tyler Quinn and I am the client manager from Highmark for Penn State's Medicare Advantage plan. There were some questions there. I'm going to save those until the end. I'm going to address a few of them at least throughout the slide deck here. But let's go ahead and get started. Oh. There we go. Okay, so today we're going to talk about the Highmark difference. We're going to review some Medicare basics and coverage lingo. We will review the network sharing rules to show you how and where you're going to be covered. We will review the medical plan benefits. We're going to explain how the pharmacy benefits work, and then we're going to just review some resources that we have at the end here. Okay, so why Highmark? We have more than 80 years of experience providing coverage. We're part of the Blue Cross and Blue Shield network, which we're going to get into here in a few slides. And then, of course, we've received national recognition for delivering high quality care. One source of recognition is our Medicare Stars rating. For those of you that don't know, each carrier receives between 1 and 5 stars to show how well their plan performs. Stars are given based on how well the plan helps members stay healthy, manage chronic conditions, the members' ratings of the plan, complaints and changes in the health plan's performance, and overall customer service. Last year, when we spoke, Freedom Blue PPO was at 4.5 stars. We are now, we've reached the 5-star goal. So we are now a 5-star plan, which we are extremely pleased with. And so it's great things happening here with Highmark. Okay, so let's just start and talk about how Medicare works. Original Medicare is Part A and Part B. You need Medicare Part A and B to be eligible for Freedom Blue PPO. Part A is your inpatient hospital care and your skilled nursing facility care. Part A typically does not carry a premium as long as you or your spouse paid more than 30 or more quarters of Medicare taxes. Part B, however, does carry a premium. The Part B premium in 2021 was $148.50. That is the average. It is income driven. I do believe, unfortunately, that it will be going up in 2022 to about $170.10. So Part C is where Medicare Advantage plans come in. Medicare Advantage plans cover everything in that Medicare Part A and B cover, but they also have additional benefits and can have benefits like prescription drugs bundled in. Part D is your prescription drug coverage. You'll notice that original Medicare does not cover prescription drugs. The only way that you're able to obtain Part D is through an insurance company. So Freedom Blue PPO, of course, has your prescription drug coverage bundled in. You wouldn't need to get an additional plan. We're going to cover those benefits here in a few slides. Okay, so let's talk about enrolling in coverage or changing your plan. So as Kelly kind of touched on, the initial enrollment period is 3 months before the month of and 3 months after the month you become Medicare eligible. For most individuals, this happens at the age of 65. Some individuals do qualify for Medicare early due to disability or other circumstances. Additionally, some individuals may choose to work past the age of 65, in which case they would commonly defer their Medicare Part B election, and that's perfectly fine as well. The annual enrollment period, which we are in the midst of right now, commonly amongst the direct pay individual market space is held from October 15th to December 7th every year. One thing that I just want to touch on with the annual enrollment period is individuals who are close to Medicare eligibility or who are already in their Medicare eligible years will just be inundated with plan information from all the different carriers. You're going to get all kinds of mailings, and you just want to be very careful this time of year that a lot of those mailings include applications, and some of them may use, I don't know if misleading is necessarily the correct language to use, but they use kind of confusing information that makes it seem like maybe you'd be getting some kind of discount or some kind of additional coverage. Medicare only allows you to be enrolled in one Medicare sponsored plan at a time. So frequently Kelly and I will see individuals who accidentally enroll themselves in other coverage. This will cause you to be disenrolled from your Penn State coverage because all Medicare sponsored plans, the applications need to process through Medicare and get their approval before we can enroll you. So oftentimes what we see is a member will accidentally enroll themselves into other coverage. They will be disenrolled from the Penn State coverage. And then Kelly and I kind of have to hustle back and forth to try and get you reinstated. So you really want to be careful, especially this time of year. It's probably a year-round thing, but particularly during this time of the year, that you're not accidentally enrolling yourself in other coverage, because it's not Highmark or Penn State that is disenrolling you from Penn State coverage at that point. It's Medicare that's essentially saying, oh, they want to be a part of this new plan, so we have to terminate them from what they're currently enrolled in.
Yeah, and Tyler, I just wanted to jump in on that.
Yeah.
I do want to mention, Tyler said we work very closely, and this time of year, we do work very closely on this issue. So, Highmark sends over a report if you've accidentally been disenrolled. They send a termination letter saying that you've been terminated due to enrolling in another plan. And then I send a follow-up letter too, based off of the report that Tyler sends me, showing me that there's been cancellations. And, and it's not saying we're not trying to pressure you guys in staying with our plan. We just want to make sure, like, hey, is this really what you wanted? So if it was accidental, we do work together to make sure that that we get you re-enrolled in our plan. And if it was intentional, then, we just ask that you sign off on the retiree request for change form, because again, like it doesn't have to be our plan, but there really are a lot of benefits to our plan. And we want to make sure that, we're helping take care of you guys if there was something that happened and it was very confusing. So I didn't want that to sound too scary. Thanks, Tyler.
Sure. Okay, so let's just go over some basic health insurance, health coverage lingo here. A deductible is, and Kelly actually touched on this, a deductible is a specified amount of money that the insured must pay before the insurance company will pay a claim. A copay is a set amount that you would pay for a covered service. Examples would be like a primary care physician doctor visit or a specialist visit. You may have a $10 copay or a $20 copay. After that, the insurance would pay the remainder. A co-insurance, that's when you have a percentage of the approved charge that you would pay for a covered service. So for example, for clean numbers' sake, if your plan pays 80%, then you would pay the other 20%. But we're going to go over all the benefits in particular here in a few slides. These are just examples. Maximum out of pocket. your maximum out of pocket is the most that you would pay for covered medical care per calendar year. This is a very important benefit and one that Penn State really takes care of their retirees with. We're going to talk about that when we go over the benefits, but the maximum out of pocket is essentially your safety net that tells you if I'm having a horrible year, God forbid, medically, what's the most that I'm going to have to spend out of my own pocket for covered medical services. So keep that in mind as we move forward here. So the plan provides the basics that you can count on. Obviously, we have the huge Blue Cross and Blue Shield network, the local care, flexibility of out-of-network benefits. You're going to see when we go over the benefits in more detail that you have a lot of passive out-of-network benefits. What that means essentially is that your out-of-network cost sharing matches what you would pay if you were in the network. So an example of that again would be like your office visit copays. If you see an in-network primary care physician, $10. If you see an out-of-network primary care physician, it remains at $10. Again, another strong benefit that Penn State has negotiated to be part of the plan. Preventative care like annual wellness visits and cancer screenings and other such services have no cost. Virtual health, we talked a little bit, or we're going to talk a little bit, and I saw a question come through about telehealth. There is alternatives to visiting the doctor in person. We understand that the world's evolving and not everyone's going to be wanting to rush into their doctor's offices or anything like that if they don't have to. Emergency benefits, you have national and worldwide emergency care. I'll probably say this a few times, but regardless of where you are, you should always go to the nearest emergency room. You should not be worrying about network at that point in time. Emergency room visits always process at the in-network level, even if the facility that you're going to is not a participating facility. They do have to accept you in the case of an emergency, and the claim will process with us at the in-network level. So you should always go to the closest place. Hearing benefits. Low copays for high quality hearing aids from True Hearing. I do not have hearing aids, admittedly, just yet, but from what I understand, some hearing aids can be very, very costly. True Hearing is a vendor that we work with that provides us 2 hearing aids that we'll go into more depth once again in a few slides here. But the fact that you can have access to hearing aids at a fixed copay as opposed to spending thousands of dollars out of pocket is a great benefit. We hear a lot of good things about True Hearing. Fitness benefits, no cost in-person and virtual exercise and wellness membership. And you can see they've moved a little bit virtually. I'm sure a lot of people, if we were in person, this is where I'd say, raise your hand if you've used Silver Sneakers. But since I can't see any of you, maybe you can raise your hand anyways, and we can just participate that way. But Silver Sneakers is a wonderful program. A lot of our members take advantage of it. They do have a website, silversneakers.com, that you can look up to see if your gyms in your area are participating with Silver Sneakers. It's very easy to get yourself set up. I do think that there's an individual Silver Sneakers card that you get upon enrolling, but you can also use your health plan ID card in the absence of that. Silver Sneakers card. And they have a very robust network. Transportation benefits, rides for non-emergency routine care. We understand that not all members are able to drive themselves to and from maybe like a routine visit. You don't need to be calling a non-emergency ambulance necessarily to get yourself to and from your visits and anything like that. So you do have transportation benefits built into your plan to provide one-way routine trips. So if you have more questions about that, we can kind of talk about that a little bit too. A few more things I just wanted to touch on here. The annual wellness visit. I'm sure you guys have all heard about this. We send out all kinds of mailings and things every year talking about the annual wellness visit. And that is a visit that truly does help us with our STARS rating. So I guess I should be saying thank you to everyone that goes out and gets that done. It's just a yearly conversation with your primary care physician to review your well-being. Very easy to do. And it helps us a great deal with our Medicare STARS ratings. The Highmark House Call program, personalized health and medication review. Some people get this confused. It's not something, they would not do the annual wellness visit for you. It's not, your primary care physician isn't coming to your house. It's This is its own program essentially, and I do believe that they have gone virtual as well a little bit to obviously people aren't necessarily keen on inviting people into their homes these days, and rightfully so. So the Highmark House Call program is a nice benefit as well. We have a clinical care team to help you manage your health. If you're someone that maybe has a chronic condition or is battling something and you're looking for someone to kind of help guide you or just work with you, we do have a clinical care team that can help with that. Nurses on call, answers from health professionals 24/7. It's exactly what it sounds like. We have staff nurses that are on call 24/7, and they're there to answer questions that you might have to the best of their ability. If you're having maybe a medical related question that you are not able to get through to maybe your primary care physician or something, or maybe you just don't necessarily want to. The PALS program stands for People Able to Lend Support, helping seniors in need. This is actually a volunteer-based program. They also provide, I've heard, rides, delivering groceries, just generally, generally just coming to visit with you if you're looking for somebody to spend some time with. I mean, these are really, really great people that are donating their time to help out where they can. PALS is mostly a Pennsylvania-based program from what I understand, but I do think we're trying to expand it as best we can. The Wellness Rewards program is earning gift cards for wellness activities. I'm sure a vast majority of you have received maybe a gift card in the past for doing something that is very easy. It's usually filling preventative gaps in care. If you haven't had, like your annual wellness visit or a screening or something of that nature, the Wellness Rewards program, we've been doing that for a few years now. People really like that, and why not? It's easy to fill those gaps in care. Okay, so let's talk about where you're covered. So Freedom Blue PPO, as Kelly said, PPO stands for Preferred Provider Organization. We do have access to network providers in 46 states and Puerto Rico. And for some of your benefits, you may pay less when you use an in-network provider, but a lot of the benefits that Penn State has designed for you guys is passive, which again, your cost sharing in and out of network remains the same, which is provides a lot of peace of mind if you're looking to go out of the network. Network sharing. So Blue plans across the country share their Medicare Advantage PPO provider networks. You can choose an out-of-network provider, but they must be Medicare participating in order for Highmark to reimburse them. So that is the one golden rule. If you're going to go out of the network, that provider does have to accept Medicare. I have not really encountered any providers that do not accept Medicare. If I'm being completely honest, I'm sure they're out there, so it's worth asking, but the vast majority of providers, in my experience anyways, do. And then, of course, as I said before, urgent and emergency care are always covered coast to coast and worldwide. You should go to the nearest urgent and emergent care center if you're needing that level of care. So this is a map, and oftentimes this map can be a little confusing. I don't want you to look at it and say, I can only receive care in the shaded areas. That's the very first thing I want to say, because I think that's what a lot of people think this is demonstrating. What this is demonstrating is network sharing. So network sharing is, again, when we can tap into other Blue Cross and Blue Shield Association plans, state to state. So the shaded areas do demonstrate the areas and the counties, because you'll notice it's not full states necessarily all the time. It's counties within the state that have a network that we can tap into. What that means is if you're traveling to an area that is shaded blue here on the map, we're able to provide you with a provider directory of network participating providers in that area. There's still going to be, just like there is in Pennsylvania, there's still going to be out-of-network providers in those shaded areas. It doesn't mean that every provider in that area is participating. But if you would prefer to stay in the network, you can do so, and we can provide you a directory to do that. Now, if you're in an area that is not shaded, and it's, as it says, there's no participating network available, what this means is we are not able to send you a provider directory that's going to say this provider is participating with the Blue Cross and Blue Shield plan in that area, because there is no network to tap into. But any provider who accepts Medicare in a non-shaded area, we call them waiver areas, but in a non-shaded area on this map, any provider who accepts Medicare is going to process at the in-network level. So if you reside maybe in a county or you're traveling to a county that does not have a network in it, we're not going to punish you for being there and tell you that you always have to be out of network. That would be unfair. The only downside, if you consider it a downside, is that we can't provide you a provider directory to say who's in and out of the network. Technically, they're all not network participating, but given network sharing rules, when you're there and the fact that you don't have a network available, the claims will process with us at the in-network level. If you're interested to kind of look to see who accepts Medicare in an area that is not network sharing participating, you could go to a resource like Medicare.gov that would easily list off all of the providers in that area that accept Medicare. And of course, Highmark customer service is always able to assist, and we'll do our best to steer you in the right direction if you have any questions. But with your plan, you're able to see anyone who accepts Medicare, regardless of where you are. Okay, so let's start jumping into the benefits. So the medical benefits here, as we said before, the deductible, there is no deductible with the medical benefits, $0, which is wonderful. The in-network out-of-pocket maximum, as I said before, this is your safety net. This essentially tells you that in my worst year medically, how much am I going to be responsible for out of my own pocket for Medicare covered services? Now, note, this does not include your prescription drugs. This is a medical out-of-pocket maximum. And if you stay in the network, your covered medical services, your cost sharing for all of those covered medical services will not go above $500. However, your combined in and out of network member out-of-pocket maximum does go up a bit. So if you choose to go out of the network a bit, your out-of-pocket maximum, the most you can spend would be $750 in a calendar year. That $500 rolls into the $750. So you're talking about an additional $250 that you'd spend if you were going out of network. Your annual physical exam and your screenings, as we said before, those are covered in full. Your doctor's office visit with your primary care physician is going to be a $10 copay, whether you're in or out of the network. Your specialist office visit copay is going to be $20, whether you're in or out of the network. Your advanced imaging, so things like CT scans and MRIs, you have no cost sharing for those types of services. And your standard imaging services, like X-rays, are also, there's no cost sharing. So we talked a little bit before, and Kelly tried to touch on it before, and there's a lot of plans that try to market to you this time of year. And they advertise things like $0 premium plans and other things like that. You really want to make sure that you're looking at this from a full cumulative viewpoint where you're taking into consideration all of your benefits. A plan that has a $0 premium likely is going to have a lot of cost sharing behind it when you actually need to utilize the plan. So you will not find a plan when you're going out onto the individual market. If you choose to leave the Penn State benefits and you just go to a carrier and say, what kind of plans do you have? I promise you will not find a plan that has out-of-pocket maximums of $500 and $750. There's not many plans out there, I'd imagine, that have 0% coinsurance for advanced imaging services and standard imaging services. And as we move into the next slides here, there's a lot of benefits really that have no cost sharing. So that's just something I wanted to touch on as we start here, but let's move into the next slide. So diagnostic testing, which is like things like blood work, there's no member cost sharing for that, whether you're in or out of the network. Outpatient ambulatory surgery. So that's, you're going to get a surgical procedure on the outpatient basis. You're not going into the hospital and being admitted. You're going to an outpatient facility. There's no cost sharing for outpatient surgery. Emergency room services carry a $65 copay. Urgently needed care carries a $40 copay. The reason that there's no in and out of network, as we said before, is regardless, when you go to the emergency room or an urgent care facility, it processes at the in-network level. So rest assured, you want to go to the nearest one. I know I've said that a few times, but I did say that I would say it a few times. So I'm just holding up to my promise. Inpatient hospital or long-term acute care facility stay, no cost sharing. I can't tell you how amazing that is to have. If you need to go and be admitted inpatient into the hospital, God forbid, you would have no cost sharing whatsoever. That is amazing. Skilled nursing facility care, same thing, no cost sharing for skilled nursing facility care. If you're not familiar with a skilled nursing facility, this is another level of care. Typically after you're having maybe a surgery or you've had an accident and you're recovering, they'd like to discharge you from the hospital, and you're not ready to go to your therapy services on an out-of-network basis. So they transfer you over to a skilled nursing facility. To have no cost sharing for a skilled nursing facility care is a very rich benefit. Part B drugs. Part B drugs can be something like the contrast material that they would use in a MRI or a CT scan. It can also be things like cancer drugs that are needed as part of cancer treatment. No cost sharing for those types of drugs either, whether you're in or out of the network. Your annual routine hearing exam, this really qualifies as a specialist visit, so it falls under your specialist visit copay of $20, both in and out of network. Hearing aids, we talked about True Hearing before. They have two options. The two options are the True Hearing Advanced, which is a $499 copay per hearing aid. So if you need just one, it's $499. If you need two, you're looking at close to $1,000. And then $799 copay for the True Hearing Premium. Again, that's per aid. Now, if you don't like maybe the True Hearing Advanced or the True Hearing Premium hearing aids, you are given a $500 allowance for any other hearing aid through True Hearing. And if you don't want to use True Hearing at all, that's okay. You're given a $500 allowance for hearing aids every 3 years from any other provider. And typically how that works, just so you know, is there are a lot of a non-participating provider would likely make you pay out of pocket, and then you'd submit to Highmark for reimbursement, and then we would reimburse you the $500 if you chose to go out of network. The ambulance, emergency ambulance service carries a $100 copay. Non-emergency ambulance services in the network carry a $100 copay. If you go out of network for a non-emergency ambulance trip, it would be a 10% co-insurance. So the plan would pay 90% and you would be responsible for 10%. This is probably a benefit where you'd want to make sure if you're getting a non-emergency trip that you may try to make sure that you're staying in the network. Your therapies, physical, speech, and occupational therapy fall under a specialist visit copay. That's a $20 copay, whether you're in or out of the network. It should be noted, though, that typically these types of therapies are going to be done on more than 1 day. So each day that you go back, it is going to be a $20 copay per visit. Renal dialysis carries, there's no cost sharing if you receive renal dialysis from an in-network provider. There's a 10% co-insurance if you receive renal dialysis out of network. Same thing for oxygen and oxygen supply, 0% from an in-network provider and 10% from an out-of-network provider. Inpatient psychiatric hospital care, there's a no cost sharing from the member's perspective if you're admitted inpatient to a psychiatric hospital. Outpatient mental health services are $20 copays, and that is per session, whether you're in or out of the network. Home health care, 0% cost sharing for Medicare covered home health care services, whether you're in or out of the network. And durable medical equipment, so that can be things like prosthetics, orthotics, diabetic testing supplies. There's no cost sharing if you get those supplies from an in-network provider. There's a 10% co-insurance if you go out of network for those. So now we're going to transition to the drug plan. So Medicare drug coverage has 4 different stages. It's important to recognize the stages, although you'll learn that Penn State has really enhanced the drug coverage for you. So it shouldn't be as much of a concern as maybe it would be for someone who is not eligible for the plan. There is a deductible phase. You pay a set amount before your plan kicks in. And if you have a $0 deductible, which you do, you skip this stage and you go to stage 2. So all of you will truly begin in the initial coverage stage. So you would pay a set amount in your initial coverage stage, like a copay. Your plan would pay the rest of the cost of that drug. And once the total of what both you and your plan paid hits $4,430, you then move to the next stage. So again, between what you've paid and what the plan has paid, once that total sum reaches $4,430, you then move into the third phase, which is called the coverage gap or the donut hole. Good news is university-sponsored coverage provides enhanced coverage during this phase. So the cost sharing remains the same as the initial coverage period. The reason that that's such a big deal is that the coverage gap or the donut hole, if you guys are not familiar, for other individuals who are not eligible for maybe an enhanced plan like Penn State's, this can be a very, very expensive, very costly phase of drug coverage for individuals, especially those who are taking high cost medications. Maybe they have a chronic condition that they pretty much have to take this medication. And so the coverage gap can be very daunting. And Penn State is providing a very strong, rich plan here to really take a lot of the burden, all of the burden really, off of the members, and so that you're not going to be blindsided by large costs during the coverage gap. The catastrophic coverage phase. Now, this is something that not everyone reaches the coverage gap, but very few people on top of that would make it through the coverage gap into the catastrophic coverage phase. This happens when you reach $7,050 of member cost sharing. So when you yourself have paid $7,050, then you would move to the catastrophic coverage phase. So very few people, if any, would probably reach this phase. But if you do, you would pay either 5% of the cost of your medication or $3.95 for your generics and $9.85 for brand name drugs, whichever is more. At that point, honestly, if you're taking medications that are taking you into the catastrophic coverage phase, it would probably be the 5%. But again, I don't think that should be much of a concern for anyone. There's not many people that would reach that. Okay, so these are the co-payments broken down. We kind of went over the different coverage phases. In the initial coverage period, where all of you would start because there is no deductible, you have your tiers here. So there's 5 tiers. You would want to make sure to know which tier your drug is in. If you're unsure what tier your drug is in, that would be in your formulary, which can be found online, but we can also send you a formulary if you're needing one. The formulary is going to tell you if you're in tiers 1 through 5. The corresponding copays, of course, are listed here. So your generics are going to be $12. If you take a preferred brand, it'll be a $20 copay. Non-preferred brand drugs are $50 copay, and the specialty drugs are also a $50 copay. Now, please note, this is a 31-day supply, so essentially a monthly supply. You also have mail order benefits for up to a 90-day supply, and you'll see that there's an obvious cost savings here. The UHS pharmacy does have access to these mail order cost sharing benefits as well. So if you get a 90-day supply from UHS, you would also get these same co-payments. So again, for up to a 90-day supply for generics would be $24. Preferred brand drugs up to a 90-day supply would be $40. Non-preferred is $50, or excuse me, non-preferred is $100, and the tier 5 specialty, you actually can't get a tier 5 specialty in a 90-day supply, so it would still be that $50 copay for a 31-day limit supply, and that's just a CMS regulation. But as you can see, there's an obvious cost savings there. You're essentially getting 3 months supply for the cost of 2. Now, as I was saying before, if you move into the coverage gap, you'll see that the co-payments are exactly the same as they were in the initial coverage period. And again, this is an enhanced benefit that Penn State is providing you. Other individuals who are not eligible for this type of plan would have significant cost sharing increases. They would see things like a co-insurance of 25%. So they could go from paying, maybe a fixed copay to 25% of the cost of their drugs, which for some drugs can be very, very costly. That's just an example. There's a wide variety of plans out there. So I don't, it's hard to speak to every one of them, but what I can tell you is that the benefits from the Penn State coverage with Freedom Blue PPO is very strong. Some of you may be moving into the coverage gap phase and you may not even know it because you're paying the exact same co-payments. And as we said before, if you somehow manage to reach $7,050 in your own personal cost sharing, you would move into the catastrophic coverage phase, which again, you'd be paying the greater of that 5% or $3.95 for generics or $9.85 for all other drugs. And Kelly, I see you popped on. Did you want to say something?
I'm sorry, I wanted to possibly address a couple of the coverage questions while we were still in like the benefit grid area where if you wanted to.
Sure, I'm not seeing, oh, okay. I think the questions are popping up on a different screen, so I honestly wasn't seeing that they were popping up. But yeah, sure, if you want to try to answer some, or we can try to answer some questions,
Okay.
sure.
Like I said, and these are just benefit related, and I thought it would be a great time to answer some of these.
Sure.
Is there a maximum number of physical therapy sessions covered in a calendar year?
That's a very that's a very popular question. So physical therapy is something that you would essentially be granted visits. It's an authorization process. So there's no limit per se. The limit essentially it's unique to your situation. So not everyone who needs physical therapy needs it for as long as maybe someone else does. So it's we are a managed care program. So it's hard to answer that question specifically, but no, there's no set cap necessarily. It's going to come as your services are being authorized.
Okay, can you possibly review, do we have emergency ambulance coverage? Can you retouch on that one again, please?
Sure, and yes, of course you have emergency ambulance coverage. We'll rewind here. So emergency ambulance services per one-way trip is a $100 copay.
Okay. The hearing aids for the out-of-network, is that $500 per pair, or is that $500 per, because you were saying how the $499 is per aid. So can you review that $500 benefit for the out-of-network?
Yeah, the $500 allowance is it's a general allowance. You're not going to be granted $500 per ear or per aid. It's $500 that you would get towards one aid or two, depending. I mean, no, unfortunately, that would just be a $500 allowance generally per 3 years.
Okay, this is a really great question as well. Does the transportation benefit for non-emergencies cover transportation from State College to Hurley Medical Center? And if so, what is covered?
So I had a feeling that the transportation benefits would be of some questions. So the plan provides a benefit for up to 24 one-way routine trips for non-emergency medical related purposes, such as doctor visits, appointments, behavioral health services, visits to the pharmacy to pick up prescription drugs, and it is limited to a 50-mile limit. So essentially what you would want to do, and I'm sorry, I don't know the exact distance that you were referring to mileage wise, but there is a 50-mile cap between where you're being picked up and where you're being dropped off. And it is something that requires approval. It's not a full-on managed care approval, but it is something that essentially you would want to contact Highmark about and inquire, and we could get you set up with a trip. And I would certainly recommend to do that prior to the day of your planned trip, so that we could get this all squared away for you at least a few days probably before your trip.
Tyler, while we're on that slide as well, how do you use the PALS program if you do need assistance for rides or groceries or that kind of service?
Yeah, you know what? I really wish that I had a direct phone number for the PALS program. I can definitely, Kelly, probably get you that for the website if it's something that you wanted to incorporate there.
Yes.
But if the person that is asking about this, if I can follow up with them, I'd be more than happy to get a phone number for them or get it to them however they need. I'm sorry, I don't have it readily available to me right now, but it is a Highmark entity. And they are internal to Highmark, so we could definitely get them in touch.
Okay, I will, when Tyler shares that information with me, I will share it on the retiree website from Penn State. But the person who asked that question, if you want to go ahead and send me your email address, I'll make sure that we get that information to you as well. Okay, another benefit question. Again, right now I'm just trying to grab these benefit questions.
Sure, that's fine.
Under the skilled nursing, what is the meaning of 100 Medicare days?
That is a great question. And 100 days per Medicare benefit period. The Medicare benefit period is a calendar year. People, I'll be honest with you, you are typically not in a skilled nursing facility for 100 days. In fact, we rarely see people that are in a skilled nursing facility for more than a week or two. Because you're typically transitioning to it. Skilled nursing is not a long-term care facility. I just want to make that very, very clear. So skilled nursing is just another level of essentially rehabilitation. You have your inpatient hospital, you have a rehabilitation hospital, and then you have your skilled nursing facility care. You have home health care that we have benefits for, and then you have outpatient therapy care. So you are limited to 100 days per Medicare benefit period, but you rarely really see people even get granted. It is something, again, just like outpatient therapy, outpatient therapies need to be approved. So do skilled nursing facilities. So if an individual is in a skilled nursing facility, it would be very rare to even come anywhere close to that many days, if I'm being completely honest with you. But there is a limit to the number of days you'd be able to be there.
And then I think for time's sake, let's go ahead and take one more, and then we can let you go ahead and finish up, and then we'll take more questions at the end.
Sure.
Okay. For the drug copays, are those the max amounts or are those fixed?
For the drug copays, are those max amounts or are those fixed? So your copay for it, again, and this is kind of part of understanding the stages, right? So your copay is going to remain, and also you want to please note the supply. So up to a 31-day supply for a preferred generic, you're only going to pay up to $12 for those generics. There are actually some situations where your generic may not cost $12. There are some generics are very, very affordable, and you may actually pay less than $12, but you would not pay more. The only time that you would pay more for a drug under the Penn State plan, assuming you're following the same day supplies that we have outlined on the graph here, is if you were to reach this catastrophic coverage period. That is when you may pay 5% of the cost of your medication, or that $3.95 or $9.85. But as I said, reaching the catastrophic coverage phase is very, very difficult. You would have already had to have spent nearly, over $7,000 out of your own pocket to get there. So to answer your, I believe the answer to your question would essentially be that they are fixed, unless you may even pay less depending on the total cost of the medication. I hope that helps. Now, I should say as well, if you're going to a retail pharmacy, let's say you don't go to UHS and you don't utilize the mail order. If you go to a retail pharmacy and you're getting a 90-day supply as opposed to a 31-day supply, then these co-payments would triple. So 90-day supply from a retail pharmacy would be up to $36. Okay, and then the tier 3 brand for a 90-day supply would be up to $60. And again, if the total cost of the medication is not as much as your copay, you would just pay the total cost. You'd pay less. Does that make sense? Okay, Kelly, any more questions?
Oh, I'm sorry. I think we're good for now. There's still some things coming into the Q&A, but we'll address those when you have an opportunity to finish the rest of your presentation.
Sure. I am not far off here. We only have a few more slides. So one thing I just want to touch on, if you need extra help paying for your prescription drugs, these agencies may be able to help. You can contact Medicare. You can contact the Social Security Administration. You can contact the state Medicaid office. If you apply for, or excuse me, if you qualify for the VA, you can contact them, of course. And PACE or PACE-Net is through the Pennsylvania Department of Aging. And I'll just leave this up just in case anybody is looking to take down phone numbers or contact information. I'll just leave this up for a minute or two here.
If you guys have cell phones, it might be a great screen to take a screenshot on, use your cell phone and take a picture of the screen.
Absolutely.
I do believe that Chris mentioned that they are recording this session as well, and they're going to be putting it up on a website. So I don't want you guys to feel like you're absolutely going to be stranded without any access to any of these phone numbers once the presentation wraps up. So just wanted to send out those little reminders as well.
And Kelly,
Okay.
you are correct. Yeah, you are correct, Kelly. We'll have this available on our website.
Chris, thank you so much for confirming.
Okay, so one other thing that I wanted to touch on is actually, oops, and I'm somehow made it so that I can't hit my button here. Here we go. Medicare excluded drug coverage. This is probably another one that you might need to take a picture of. I know that the print is maybe a little small, so I'm sorry if not everyone's able to see this. But what this is essentially showing you is an additional benefit where Penn State has allowed you to get Medicare excluded drugs. What this means, and just so you know, I pulled this directly from the annual notice of change letter. And that probably came out, you may have received that just before or around the same time that you received Penn State's letter. This is page 60 of the annual notice of change letter that went out to all current Penn State Freedom Blue PPO membership, and like I said, in the past couple of weeks here. And this listing captures numerous prescription drugs that are Medicare Part D excluded. And what that means is no Medicare Advantage plan or standalone Part D plan would cover these medications without an enhanced rider or some kind of enhanced coverage like the one that Penn State has negotiated for you to be a part of your plan. So if you have additional questions about this, I'm not a pharmacist, but you can ask me, but you can also certainly contact our member services or reference the annual notice of change letter that was sent out within the last couple weeks. Again, I don't know if anybody's writing anything down, so I don't want to progress too quickly, but I guess if we have a question or something and need to come back, we can certainly do that. Okay, and the last thing that I wanted to touch on before I wrap up here, there is a new process for demographic updates. This is fairly new within the last couple months or so, and Kelly and I have been working on this together. So due to CMS compliance guidelines, Highmark is no longer able to accept demographic change information from Penn State's HR department. These updates will need to come from plan participants directly. So in the past, you may have notified Penn State of your demographic changes, your address updates, your telephone number updates, and they would pass those along to Highmark. At this point in time, we are no longer able to do that, unfortunately. So it will be your responsibility as plan participants to contact both Penn State University and Highmark when any address or phone number updates are needed on your account. I did list the number for Highmark's member services here. That is the same number that should appear on the back of your identification card. Highmark customer service should offer to warm transfer you to Penn State if necessary. If you've already updated with Penn State, obviously you could decline that warm transfer. And then of course, I believe Kelly had this on a few of her slides at least, but if you needed Penn State's HR phone number, that's there as well. Kelly, I hope I've put the right phone number there for you.
Yes, that is the correct number for our HR services team.
Okay. Okay, so that is actually all that I have at this time. So I know my next slide is some of the same information that Kelly had, and she called it out. I have it too on mine. If you are a prospective member or not currently a member and you're looking to be a member in the future, you would want to contact the phone number there, the 866-456-7739, and you would want to use the reference code listed there. And essentially that's just the year, the plan, and then the group that it corresponds to. If you're a current member, you would just want to, of course, call the number on the back of your ID card, which I've listed out there for you as well. If the two get intertwined, you will not get the correct person. So you want to make sure you're calling the right number to get the correct information. So I guess we're going back to the questions if we have time.
So before we hit the questions, I do just want to point out, I know we get every year the question of, well, why should I stay with the Penn State plan? And is the Penn State plan really the best? And I think Tyler did an excellent job this year of really pointing out some of the differences in the Penn State plan. Those Medicare excluded drugs, our $750 out of pocket maximum, that's your worst case safety net. So again, as people are getting inundated with all of this information, you want to take a look. Yes, you've got those zero premium plans that are being offered to you. You're going to be paying $80 a month for the Penn State plan. That hasn't changed in about 3 years, maybe 4 at this point. So you don't want to just look about the money that you're paying out of your pocket every month for premiums. You also want to take a look at the benefit and those benefit caps that Tyler went over on the Freedom Blue plan. Those are very rich benefits. So again, not putting pressure on anyone. If it is your intention to stay with Penn State, you do not need to re-enroll and you do not need to take any further action. So there's nothing that you need to do in order to go from 2021 into 2022 in the Freedom Blue plan. If you are in our non-65 plans, the only time you need to take action is if you want to change plans. You want to go from the PPO plan to the PPO savings plan. All right, so with that being said, I'm going to go ahead and jump to some of these questions. Okay, that question just got answered. Tyler, silver sneakers will not be accepted any longer at Hempfield Sports Complex as of 1/1/2022. I don't necessarily want to find another facility. Is there anything that can be done?
I don't know what kind of pull that I have with silver sneakers personally, but I'm happy to put in that comment and see what can be done. There's probably a lot of circumstances around that we wouldn't be aware of as to why they don't want to participate with silver sneakers and other such things. So I can certainly take that back to my team. I'm sorry, I don't have any guarantees that anything will change though, as it pertains to their participation.
Tyler, this one seems to be a little bit of a personal nature, but I'm wondering if I don't even want to call out the front name. So I'm just going to read the question out loud. I'm going to ask that you go ahead and send me your email address in this Q&A spot as well. And we're going to have a high-level service rep from Highmark reach out to you. The person who's indicating Geisinger has tried to billing my Highmark Medicare several times, but Highmark is telling them that they're not the primary insurer. What can I do about this? I've already spoken with Highmark and was told I don't need to do anything, but Geisinger seems to keep sending me notifications to take care of this. And so the person that's sent that in, if you could go ahead and give me your email address, I'm going to go ahead and have our high-level service reps at Highmark reach out to you directly.
Yeah, I think I saw the name as well, Kelly, so I'm going to take that down on my, did it move?
Oh, I did. I put it in the answered question.
That's okay. I'm just going to take that
okay.
name. Just one sec.
I was being a little too quick. Chris, okay. Before I keep going, I do want to confirm we're good on time. I know it was supposed to wrap it at 3:30, but I want to make sure you have time for closing remarks.
You have plenty of time. You can move ahead. I would say you have about 15 minutes.
Okay, thank you. Thank you, sir.
Thank you.
We live in a retirement village that provides skilled nursing care. Does Highmark cover us?
That we would probably need to know more about who that is and what it is that they're doing for you and if they're billing the insurance. So there's a lot of variables there. It's going to be hard, and not to cut the question short, but it's going to be hard for me to answer those types of questions because there's a lot of different variables at play. But I'm happy to, again, Kelly and I can work together and make sure whoever has questions that needs maybe more individual attention and research, that will certainly circle back to you and get you the answers that you need.
Does Johns Hopkins and the Mayo Clinic accept our insurance? Do you know off the top of your head if they're participating? And again, okay.
Yeah, I know that Johns Hopkins does. I would have to look into the Mayo Clinic, quite honestly. I want to say yes, but I know for a fact Johns Hopkins does. The Mayo Clinic may be out of network, but if they are, keep in mind, you do have out of network benefits and you should have no trouble utilizing them.
Oh, okay. Someone is asking, this is one that I can field. What website will the charts be on? So those detailed benefit summaries that we've talked about for the PPO and PPO savings plan, and we even have a detailed Freedom Blue summary there as well. If you go to hr.psu.edu/retiree, and if you go to hr.psu.edu, on the right-hand side of that website, it says retiree. You can click there, and that's going to get you to our retiree website as well. Let's see. What do we have with home health care? And that's how the question came in. So I'm not sure if that maybe.
Yeah, I can.
Okay.
Again, home health care is, it's going to be based on need, just like any other type of therapy. Typically, they provide therapy services for you in the home. You're kind of in between that skilled nursing facility care and being able to travel outpatient to a facility on your own. So most of the time, from what I understand, that would be therapy related services, but it could be a little different for everyone who's able to utilize it and is approved to utilize it. So I would encourage you that if you are looking to receive home health care, you would obviously need to coordinate with a physician who's advocating on your behalf to have that type of care.
Okay, I was just getting some information that we're going to be following up on, Tyler. I'm the Penn State retiree and just turned 65, so I am a Highmark member. My spouse turned 65 in March, so he is on the Aetna plan. What and when does he need to do to get on the Highmark plan when he turns 65? So I haven't sent out the March age-in letters yet, but those should be coming out probably in the beginning of December. You're going to get a letter from us here at Penn State that says, hey, we see you're turning 65. Don't forget to go to the Social Security office, sign up for Medicare Parts A and B, so you can be in our Medicare Advantage plan through Highmark. And we're going to walk you through those steps. So a little bit early yet, but you will be getting a letter probably in December to talk about those steps that you need to take. I have retiree colleagues here in North Carolina who are not retiree association members. Will the presentation be available for these retirees? Chris, is there any way you could field that one?
Our website is easily accessible by anyone, whether you're a member or not. You can just get on and Google the Penn State Retirees Association website. So this information will be on there. Is that answering the question as far as someone having access to look at this?
Yes.
Yes. I mean, there's no member code or any kind of a firewall that prevents you from going in and looking at our website. So anyone can do that. And we will be having this presentation on there in a few days after we have an opportunity to get it downloaded into the website.
Chris, thank you so much. Are pre-authorizations required for any service, Tyler?
I hope I'm understanding it right. Pre-authorizations are required for some services, not for every service though necessarily. Yes.
And so to determine which services do require a pre-auth, they call the Highmark number on the back of their card and they can find out?
Yeah, and it's typically well understood. Usually when you're trying to receive a service that requires an authorization, that's the types of services that come to mind for me would be most imaging services, particularly advanced imaging services, therapy services, surgical procedures, things of that nature. This isn't something that a member directly would be, you as a member do not apply for your own authorizations. It's all coordinated by a physician. And you, with that being said, though, you should receive a copy in the mail of any kind of authorization that's been submitted for you and the outcome.
Okay, so this one's for me. Are there any benefit mentors or calculators to help us with deciding between the PPO and the PPO savings plan? Unfortunately, that is a tool that's only available for our active employees, but that is definitely a suggestion. I can maybe talk to the benefits team manager and see if maybe for future years that might be something that we could do. But at this time, that is only. So the best part, since you don't have an actual calculator, the best advice I can give is you log on to the Aetna website. You can kind of take a look at all of your claims from the past year, and you can take a look and see, you know, how many times did I go to the doctor? What was my copay each time? And, you know, you can kind of have an idea about your own utilization that would then help you determine between the two plans. On TV, we are inundated with ads to call more and get more information from Medicare. Should we pay attention? You know, one of the things we were really trying to do today is highlight the benefits and the strengths of the Penn State plan. You know, again, I work for Penn State. I can't sit here in good faith and conscience tell you guys, nope, you can't look at any other plan because, you know, we want you to stay here with us at Penn State. On a personal level, again, I've got many family members that are retirees at Penn State. It's a phenomenal plan from everything I've seen and I have compared it to. But again, you know, the one thing I do want to let you know, if you're going to market your plan, look at what you're paying in premium. What are you paying out of your pocket every month just to be enrolled in that plan? Also take a look at what your out-of-pocket maximums are on the other plan. Does it make sense to you to maybe pay less out of your pocket every month to pay more when you go to the doctor? That's a really big thing you want to look at. The other thing I want to remind you is once you drop the Penn State plan, you are not able to re-enroll at a later date. And so it is important for you guys to recognize that as well.
Kelly, this is Alan Cameron jumping in quickly.
Absolutely.
As past president of the association, I've attended Big Ten retirees meetings on several occasions. The Penn State retirees medical plan is the envy of all of the other Big Ten universities.
Thank
And
you.
I would say that some of those other Big Ten universities have very, very good plans. So yes, you're an employee of Penn State, but our plan is an excellent retiree plan.
You're actually going to make me cry. I really appreciate you jumping in and saying that. That's and someone else. I've had many medical bills this year, including a hospital stay and home health care. I can't speak highly enough about my Highmark coverage. Again, these are great shares. These are great stories to tell one another. Ooh, I'm super emotional. It's definitely becoming the holiday thankful time.
Yeah, I'm seeing a few of those comments in here. That's great.
Yeah, and Kelly, don't worry. Alan makes a lot of us cry.
Boy, I am really tearing. I'm going to have to try to really read these comments. Okay. There's still quite a few questions, Chris, and I want to make sure you have your time. Do you want me to keep going?
Well, why don't you take 3 more questions?
Okay. As Chris said, we're going to go.
I can try to type some answers too, quite honestly, after we're done, and maybe just so people feel like if there's answers that I can provide anyways.
Okay. We're going to go ahead and take 3 more specific questions, but the phone numbers that we provided, again, you know, please don't hesitate to reach out. We will make sure that we get your questions answered. And, you know, a lot of times if I'm not able to answer those questions, I put them over to my high-level service reps at Highmark, and they have them reach out to you guys directly. So there's still availability to get your questions answered. What Penn State medical benefits and or cost have changed for 2022? Most of everything looks the same. It is the same. There are no changes to the plans or the cost for the upcoming calendar year. If you go to the hospital and you are not admitted after 72 hours, are you responsible for the bill? So if you go to the hospital and you're not admitted after 72 hours, are you responsible for the bill?
I guess I don't know why you wouldn't be responsible for the bill. I know that your emergency room copay is typically waived if you are admitted to the hospital for the same reason that you've gone to the emergency room for. But if there's a more specific question at play or a bill that you're receiving that you're uncertain about if you actually owe it, you know, I'm more than happy to follow up with you. But my answer would be yes, to an extent assuming they're billing you correctly. And that's something that people should know. I mean, it is possible, billing errors happen. You want to make sure that you're reviewing your bills and your EOBs appropriately for all the services that you receive, so that those types of mistakes do happen. So if there's a specific billing question or something that I can look into for you and review your claims, I'm happy to do that. But my answer would be most likely yes. It wouldn't just get waived.
Okay. You know what? A lot of people do seem to be asking questions about the transportation benefit. Under the transportation benefit, is this 50% of the cost of travel one way?
No, and I have seen those questions too. Let's see. Let's see here. Get back to my. So again, the plan provides a benefit for up to 24 one-way routine trips. And I know that I'm seeing some people kind of dwelling on the one-way aspect. You can schedule yourself a round trip that's considered two one-way trips, so you can schedule yourself a pickup from your location to your destination and a pickup from where you were, the doctor's office will say, home. But the point of the way that the benefit is worded is just to let you know that it is up to 24 one-way trips, and there is a $10 co-payment per one-way trip. If you, so I'm not sure I understand the 50% aspect cost of travel, and maybe that pertains to if you're trying to be reimbursed and it's considered an out-of-network provider. And if that's the case, then again, that's probably something I would need to look into. So any claim that you're submitting for reimbursement, let's say you were able to find a routine transportation vendor that's out of network. Any claim that processes through the plan has an approved cost, a negotiated cost. I'm sure you guys have seen that on your EOBs. So you would be reimbursed 50% of that approved cost, and you'd be responsible for the other 50%. But to avoid that altogether, I would encourage you, before you're scheduling these types of trips or trying to submit for reimbursement, to just coordinate through Highmark and our approved vendors. That way you can stay in the network and you'll just be paying your $10 copay per one-way trip. But again, if there's maybe some follow-up that needs to be done here, I'm more than happy to do that.
All right, Tyler, thank you so much for your time today. And Chris, I can't thank you enough for inviting both Tyler and I here today. So we're going to go ahead and turn it back over to you.
Okay, thank you. Again, if anyone does needs additional information or has a question, you can certainly refer to the numbers that have been provided in regards to contacting Penn State or in regards to contacting Highmark. And just again, a reminder, this program is being recorded and will be up on our Penn State Retirees Association website. But I want to thank you, Kelly and Tyler, for a very informative presentation. It's always well received. We get a good amount of feedback. I did have a question that came in again. Somebody emailed me, and I figured that it's just one. And I would ask you, if you're still hearing me, is that there was some mention, Tyler, about MRI and CT and X-ray that you can go, and there's no charge for those services. Does it depend upon where you go for those tests? So for instance, in State College, you can go to, the Mount Nittany Medical Center, you can go to Geisinger, you can go, I mean, is there a certain place you have to go to have them covered, or are they just covered?
So to answer the question, imaging services in general usually require authorizations. So the caveat, I guess, if there is one to the benefit, is assuming it's approved and authorized, you would not have any cost sharing for it. But you can't just, walk into, and again, these are things that would be seamless to the member. If you're being asked to have a CT scan or an MRI or something, your doctors are coordinating that for you behind the scenes. They're submitting for approvals to your insurance behind the scenes. You should not, really actively be participating in that process. But assuming it is approved, medically necessary, you would not have cost sharing for those services.
Okay, so hopefully the person who sent me that heard that, and your question was answered. Again, we'll have this information on our website, so feel free in a couple of days, give us a couple of days or so, and you can get on that website and you can review this and pull it up. I did want to remind or mention to people that our next meeting is going to be in January 20th, 2022. And we, as has mentioned earlier on by Glenn, when we first started our presentation, that we do have our meetings normally on the third Thursday, our membership meetings on the third Thursday of the month. Sometimes there is a change. If it happens to be a Veterans Day or something like that, we might make a change, but those are always posted well in advance. The months coming up where we'll actually have programs will be, of course, the January program, as I mentioned, is our next one on the 20th of January. And then we'll have one in March. May is our business meeting. September is our picnic. And then again, next November, we'll have our annual benefits meeting again. We are working on finalizing our 2022 programming schedule, so please stay tuned. I would like to reach out at this point now and just say, are there any other items, either from anyone that's on our panel or our presenters that might have something for the good of the order?
So there was a question of the number of participants. I saw a maximum of 154.
That's great. That's fantastic. Anybody else have anything for the good of the order? Oh, okay. Well, if not, on behalf of the Penn State Retirees Association, we wish you a very happy Thanksgiving and a safe and healthy holiday season. I'm hearing nothing else coming up. I will move to close the 441st meeting of the Penn State Retirees Association. We'll see you next year. And don't forget to renew your membership. Thank you, everyone. Have a good evening.